All right, hi everyone. Good afternoon. This is Dr. Theo Swala. We are back on Dr. Gilead show. I am so sorry. I have been out of communication for 2 weeks. I was out of the country, but we're back. We are on WBGR Radio and on Facebook Live. Dr. Gilead show. I am your host. Today we're going to talk about alcohol use disorder. I want to welcome you back to the show. You can call on WBGR Radio 301 429 9247. 301 429 9247. We're talking about alcohol use disorder. But before we start, as we used to do normally, I'd like to let everybody know.
Yeah, call.
Yeah, I got a caller. Let him hold on 1 minute. Put him on hold.
All right, this is Barry Camp. I'm tapped in.
Yeah, okay. Hold on 1 sec, Barry. I want to say that please do not use what you hear on this platform to make a diagnosis of yourself or someone else. Do not treat someone else based on what you hear on this platform. It's always good to get treatment from a licensed provider, a physician, to treat you properly. Dr. Gilead showed the providers will not be held responsible for what you do based on what you hear on this platform. Today we're talking about alcohol use disorder. We're going to talk about the disorder, the intoxication, and alcohol withdrawal. Alcohol use disorder may be mild, moderate, or severe. The question is why sometimes some people drink when they want and others have to drink every day. They will do everything possible to get the alcohol. That is the addiction. So what makes it a disorder is if there is a problematic pattern of alcohol use leading to clinically significant impairment and distress. So what makes it a problem is actually when people drink constantly, they cannot help themselves, and they just have to continue to drink. I think we have a caller on the line. Hello, Barry.
Yes, I'm here.
Oh, how are you, sir?
I'm doing fine today. How you doing?
Good, good. So today we're talking about alcohol use disorder. Alcohol use disorder, which is an addiction. So you have a question or you have a contribution so people can learn?
I got a contribution, yes. I grew up in a neighborhood with a whole lot of alcoholics, submerged. Alcohol abuse can be devastating, You end up drinking every day. Certain amount of days, you're cooking your liver. Okay? Not only getting addicted, you're killing yourself. If you drink every day and, decide to stop, you have to wean off of it, just like you would have to do drugs.
Right.
I mean, drugs and alcohol, they run side by side.
Yes.
Like, you know what I'm saying? The only thing that's different is alcohol is legal. So, you want to try to refrain from the thinking of that, okay, this is legal, I'm going to do this. Have a better life for yourself without intoxication. Intoxication is intoxication.
Right.
No way around that.
Okay. Well, our viewers and our audience, they're hearing you, and I'm going to get into more details about the effect of alcohol on our bodies, relationship, and all that, and I'm sure they've heard you. This is very beneficial to them. Stay tuned, and I'll be talking more about all that. Thank you very much for calling in, Barry. Okay, thank you. So the caller talked about the devastating effect of alcohol on your body, and he said he grew up in alcohol-infested area. I'm sure he has quite some experience with that. So it's a good information. Now let's take a look at how prevalent, how common is alcohol use. Alcohol is everywhere, and the problem is it is legal. It's just that we have an age limit where you can legally drink. And that transition from when you can drink to the legal age limit when you can drink is very, very dangerous. And we've had college students, once they hit the age of 18 and they say, yeah, legally I can drink now, they end up drinking too much because they don't have any tolerance yet and they die. So alcohol could really be dangerous. Let's look at how prevalent alcohol use disorder is. Now, it is a very common disorder. In the USA, among 12 to 17-year-olds, it is 4.6%. 4.6% of 12 to 18-year-olds underage drink alcohol. The question is, how do they get it? Because the liquor stores are supposed to ask for your ID to make sure you are old enough to drink alcohol. But they get it anyway, so which means somebody is buying them the alcohol. So 4.6% of 12 to 17-year-olds drink alcohol in the United States. For adults, it is 8.5% among adults aged 18 years and older. And it's known that the adult men drink more. And the prevalence is about 12.4%, while women is about 4.9%. But a lot of our women are drinking a lot these days, which is a big deal. But hey, anybody can drink. Now, among the races, among different races, it's known that the Hispanics drink more than most people. Among the adults, the Hispanics, as a matter of fact, the 12 to 17-year-old Hispanics, 6% drink alcohol. Native Americans, 5.7%, and the whites, 5%, and black people, 1.8%. So the young white people really don't drink a whole lot compared to Hispanics. Among adults, the Native Americans are the highest, about 12.1%, a huge number, a whopping number, drink a lot of alcohol, and Hispanics 7.9%. But worldwide, it's known that 3.6% of the world population have alcohol use disorder. 3.6%. If you compare that to how many billions of people in the world, that would tell you the number of people who are addicted to alcohol. If you're cutting across different regions, in African regions it's about 1.1%, and is higher in American regions, which is USA, Canada, South America, is about 5.2%. But the highest rates is in Eastern Europe, which is about 10.9%. In Eastern Europe, a lot of people drink alcohol, and alcohol use disorder is very common in those areas. What are the symptoms? How do we say someone has alcohol use disorder? Now, we know this, or we can say someone has alcohol use disorder if they are taking large amounts of alcohol and over a long period of time than was intended. And that means they set out to drink 1 beer, they end up drinking 10 beers. Or they want to drink for just an evening, they end up drinking all night. That is a typical presentation of someone who has alcohol use disorder. Number 2 symptom is the being unable to limit how much alcohol they drink. They can't stop themselves once they start drinking. Another symptom is having strong craving, strong desire or urge to drink. They can't stop. They just have that feeling, continuous urge to drink, continuous craving to drink. This is very devastating for them because they really don't want to drink, but the urge is there. They cannot help themselves. Another symptom is desire and unsuccessful attempts to cut down. They know they're drinking too much. They want to stop, but they cannot. You see them, they say, look, I'm going to cut back. I'm going to stop by the time I turn 50. The day they turn 50, they get plastered. They drink so much. So they make unsuccessful attempts to cut back on how much they drink, and they can't help themselves. Another symptom is they find themselves spending a whole lot of time drinking. They drink so much, they spend so much time drinking. They also spend so much time trying to recover from the time they drank. Because once they drink a whole lot, the body is in a bad shape, so they spend another long time recovering from the one they drank the previous time. Now, because of these, they have difficulty fulfilling their major obligations at work. If they are students, they can't keep up with their studies, and also with the need to keep up at home. So a parent can no longer take up their responsibility at home or at work. If students, they can't keep up with their schoolwork. Now, another symptom of alcohol use disorder is they continue to drink even though it's causing them a lot of problems. I have some patients that they drink, they get in trouble, yet they continue to drink. It affects their personal life, it affects their physical life, it affects social life. The wife or the husband says, I'm going to leave you, and yet they continue to drink. That is a major problem. That is one of the major symptoms of alcohol use disorder. So they find themselves wanting to quit. They're losing their job, they're losing money, they're losing their family members, they're being abandoned by their spouse, wife or partner or husband, as the case may be, but yet they continue to drink. That is a major symptom. Now also they have, they begin to lose time, they disconnect from their social, occupational or hobbies because they cannot give up alcohol. So if they have a hobby, someone who used to play basketball or go do soccer or hang out with friends, they cut that out because they can't make out time to indulge in such helpful hobbies because they can't quit drinking. So they spend too much time drinking, cutting out the right things they're supposed to do. Another symptom of alcohol use disorder is using alcohol in hazardous situations. And this could be someone getting drunk and driving. People have had multiple accidents, gotten DUIs, DWIs, but yet, under probation, they still go out and drink. There are also other hazardous situations would be like going to swim when they are drunk. So they get in trouble, they almost get, they almost die in the swimming pool, drown, and they are rescued. The next day they go back and drink and go to the swimming pool. So they indulge in these hazardous conditions when they are drinking. This is another classical symptom of alcohol use disorder. Now, other symptoms are continuous to use even though it causes physical and psychological problems. You have someone who they drink, they throw up, they vomit, even vomit blood, and the next day they go right back to the liquor store. Or they have liver problem, their eyes are yellow, they're weak, their body is itching because of the liver problem, yet they go out and drink alcohol. So they continue to drink even though they have these severe physical symptoms. Some even have psychological problems. When they drink, they get very aggressive. They beat up their spouse, their wife or husband. I have seen women beat up their husband when they're drunk, and the wife or the husband threatens to leave, yet they go drinking. So psychological problems are there. They get depressed more after they get caught up with the drinking, or they go through withdrawals, all kinds of problems, but yet they continue to drink. The other symptoms are things like developing tolerance. They have to drink more to get the desired effect. So when they drink, they feel happy, or they feel more confident. So one beer can't do it anymore, or one drink cannot do it. They drink more to get that good feeling, to get that boost of confidence, to talk to people, to connect to people. So they have to drink more because they have developed tolerance to alcohol. Also, a lot of them will develop withdrawal symptoms. And withdrawal symptoms are the symptoms that they have if they don't take alcohol. So they have symptoms like throwing up. They go through things like your heart beating fast, sweating, shaking. They go through the shakes. So they have to drink more to calm the bodies down. So these are withdrawal symptoms. Once people begin to have all these symptoms I've mentioned, continuously drinking more, drinking excessively, indulging in dangerous, hazardous conditions, and they go through withdrawals, they have alcohol use disorder. It becomes a disorder and not just social drinking, because they cannot help themselves. They cannot stop drinking when they want to. If they don't have money, they have to find a way to get alcohol. They even pawn their materials, their properties, sell things so they can buy alcohol. That is classical, or these are classical symptoms of alcohol use disorder. Also, there are periods of intoxication. They get intoxicated, and this happens when the amount of alcohol in the body increases. Now, it is the level of intoxication differ. It may range from mild to moderate to very severe. So at some point they may get impaired, and initially they may have some little inappropriate behavior, unstable mood. They talk things they shouldn't talk, become excessively talkative. They become inappropriate sometimes. They have impaired judgment, and as they drink more, they have slurred speech, poor coordination. That's when the police tells you to walk on a straight line. They can't walk on a straight line. They start tripping over. Or sometimes the drinking is so much that they have blackouts. Now, what are blackouts? Blackouts are when someone has drank so much that they have a period when they lose memory. They remember leaving the liquor store, or they remember leaving the party, getting into their car. That's all they remember. The next day, they don't know how they got home or how they even drove to their house. And I've had a patient who, when I visited someone, drank some there, then left the place, did not remember how he got home, but by the next day he looked at his car. He had lost 2 fenders, had a flat tire on the left side of the 2 left tires were gone. He had no memory of how he got home, how he lost 2 fenders, how the tires got punctured. The next morning he saw these things. That is classical of blackouts. Now, there are all the extreme of people can get into a coma or die. So these all depend on the level of alcohol consumption and how fast they drank, the quantity of alcohol they took. Now, let's take a look at the alcohol testing, the breathalyzer that we use in testing people, and also the law enforcement agencies use in testing individuals when they think you've been drinking. The breathalyzer tests the amount of alcohol in your breath. What happens is the blood flows through the lungs, and when you breathe, the alcohol that is in the blood will come out through your breath. So the breathalyzer is correct, is perfect. When they test it, depending on what the breathalyzer says, if they do a blood draw, it will give exactly the same number. Now the breathalyzer, when it's negative, that means no alcohol detected at all. Now you have lower limits of alcohol, and that is below 0.01%. When it's below 0.01%, you don't really detect anything. Now, by the time the blood alcohol level through breathalyzer is between 0.01 to 0.05%, the person begins to have some loss of judgment and coordination. They become excessively talkative, and they may act a little inappropriate towards the opposite sex or even same sex, as the case may be, depending on the person's sexual orientation. Now, so they have poor judgment at that point, but once the blood alcohol level hits above 0.05 to 0.08, their functional ability is impaired. They are completely impaired. They can't really make correct judgment. They can't function properly. And when the blood alcohol level is above 0.08%, functioning and judgment are very seriously impaired. This is considered positive for driving under the influence in most states of United States of America. So in the USA, if the cops, the police pulls you over and your blood alcohol level through the breathalyzer is above 0.08, you are legally drunk and you will be arrested for driving under the influence. In most states, that is that. But now I think that they're trying to put it down because a lot of accidents are happening because people are drunk and doing things that they shouldn't really do because they are drunk. Now, when blood alcohol level gets to 0.3 to 0.4%, it is potentially fatal. People have died once their blood alcohol level gets to 0.3% or 0.4%. This is not uncommon with college students. Once they hit age 18, they haven't been drinking, or they may have been sneaking some little alcohol, so they have very little enzymes that metabolize alcohol in their liver. So they drink so much in one night because they are legally old enough to drink. And unfortunately, the enzymes that metabolize alcohol is very low in their body because they haven't been drinking. So very mild alcohol intake will quickly hit their blood alcohol level to above 0.4%, and they can die. They go into coma and they may never wake up. But if they are taken into hospital quickly and taken into intensive care units, respiration is taken over by the doctors, and they could stay. I've seen someone stay 4 to 5 days in coma from alcohol intoxication, but they made it because they got to the hospital or they were taken to the hospital and they were appropriately taken care of. So college students, young people have to be very watchful, because if you haven't been drinking, the enzymes that metabolize or break down alcohol is very low in your body. If you drink so much so quickly, you can get into alcoholic coma, and it can kill so fast. Now also there is what we call alcohol withdrawal. When alcohol withdrawal occurs, it happens usually when people have been drinking heavy and for a prolonged time. And once they stop cold turkey, or they reduce very quickly, they go through withdrawals. And this could happen quickly within 3 to 4 hours when they stop drinking. And the withdrawal symptoms could last up to 4 to 5 days. The presentation, or how this occurs, or how this presents in the person when they're going through alcohol withdrawal, is they have excessive sweating. They're sweating a lot. They have palpitations. The heart is beating so fast. They also have tremors, the shakes, the body is shaking. They have poor sleep. They could sleep too much. They have nausea, and some people could have bouts of vomiting. Some have hallucinations. They see things that are not there, or even hearing voices. Some could get very, very agitated, severe anxiety, and they may have what is called delirium tremens. So they become delirious, they don't know what is going on, they have seizures. Chances of dying is very high if they have delirium tremens. They have seizures, they become delirious, disorganized, that could that could lead to death. So we have to be very careful when we are drinking so much. All right. I see Head White and Chuck. Thank you for tuning in. If you have any questions, you can call on WBGR Radio 301-429-9247. 301-429-9247. That's the WBGR Radio. You can make your contributions, or you can also ask a question. We'll be willing to answer that question. Thank you. Now, when do you need to get help? A lot of my patients come in, and when I talk about alcohol use, they say, well, I just drink a little once every night. I drink 1 or 2 beers every night. And weekends I drink maybe 4 or 5 beers. Am I alcoholic? Well, the question is, if you don't drink in a night, what happens? Do you go through withdrawals? Do you go through the shakes, palpitations, confusion, hallucinations? At that point, you will need to get some help. So at what point do you get help, or do you ask for help? Now, if you feel that you're drinking too much alcohol, or if you think or if you notice that it's causing you problems at your job, you're missing a lot of work, missing a lot of days from work, it's causing you family problems, or your wife or your husband, your spouse is threatening to leave, you're not paying your rent, you're missing out on your regular payments because you're spending your money drinking, it is time to get help. Or even your family members are concerned that you're spending too much time drinking, you're spending too much money drinking, or you're getting into fights, you're getting into trouble with the law. It is time to get help. And also, family members can help the individual contact healthcare providers if your loved one is going through these situations, these problems that I mentioned. So it would be good to help if a loved one, if they are using a lot of alcohol, doing things they're not supposed to do, getting in trouble. Family members can help. At this point, I think we should take a break. Stay tuned, don't go away. We are on Dr. Gilead Show, on Facebook Live, as well as on WBGR Radio. We're talking about alcohol use disorder. This is a very, very common problem. So you can call on 301-429-9247. If you have experience with using alcohol, or you have a family member that is constantly using, you want to ask a question or contribute so that our audience, those on this platform, can hear you and get some help, please call 301-429-9247, or you can also send us a tweet or send us a message on Facebook. A question, we will answer it. But don't go away. Stay tuned. We're going to take a short break, and we'll come back shortly.
your friendly Avon representative. Just in time for the holidays. You can order Skin So Soft, all of your makeup products, toys, clothing, and so much more. But guess what? You do need a representative in order to order Avon. So you can order online and have the product shipped directly to you. All you have to do is log on to www.youravon.com/2blessed. That's www.youravon.com, the number 2blessed. Happy shopping and enjoy your product.
Oh, it turned off?
You told me to turn it off, right?
No, I thought it was off already.
Have you been meaning to get a massage but it keeps slipping your mind? Would you like to experience the positive overall effects of a frequent massage in your life? Could you benefit from member discounts on massage services and products? If you can answer yes to any one of these questions, then our memberships are the way to go. Why be a Care Essence member? We're glad you asked. Simplicity is redefined at Care Essence Therapeutics LLC, where our mission is to help you feel better, offer health information and education, and teach you to be an advocate for your health. We offer sports massage, medical massage,
Right now?
No, after that one.
and all injury claims. We're located at 7211 Hanover Parkway, Suite D in Greenbelt,
No,
Maryland.
you can.
Please call us for our promotional package and membership rate. Our number is 202-689-4585. Again, it's 202-689-4585. Please allow us to serve you because your care is
When it goes off.
And be sure to like us on Facebook at Care Essence Therapeutic
And then
Massage.
put that other one, drag that other one into the one that's playing after it goes off.
Wait, what?
So press play.
This one?
No, press play. And then drag that one over there.
Well,
No, it's this is having trouble, so they're trying to reconnect it.
Drag this blue right here.
Yes. Okay, now drag it up.
Right here.
I can see we lost internet connection.
Say that again. Just put it back on, cut that off, and then cut that back on.
Hey guys, it's Chanel Monique. Tune into my show every Saturday at 12 p.m. Eastern Standard
Right.
Time and the rebroadcast Monday nights at 5 p.m. Eastern Standard Time. It's Chanel Monique. Have faith in God and pursue your purpose.
Why is it moving so slow?
oh, we have to go.
Yeah, it's still recording.
Yeah.
Okay.
All right.
Can you press up?
All right, guys, welcome back to Dr. Gilead Show on WBGI Radio and on Facebook Live. Today we're talking about alcohol use disorder. So there was a tweet somebody sent. It says, why will someone continue to drink even though it's causing them problems? So that is a big question. That is the addiction that this person has. Now, once you start drinking alcohol, there is a center in the brain where the person gets some satisfaction from drinking, the satiety center for alcohol. So what happens is always that center will crave for alcohol. Even though they're going through problems, they're having all kinds of problems, they're having all kinds of physical or psychological problems, they still continue to drink. It is a problem. Even they go through withdrawals, they throw up and all that, but also is genetic in them. But anyway, we're going to take a look at the causes of alcohol use disorder, why people drink, and maybe that also will answer the question. Now, so what are the causes of alcohol use disorder? Number one is genetic. So in most families, it is being shown that that 40 to 60% of alcohol use disorder is genetic. The rates are 4 times higher in close relatives, more than in distant relatives or other people. So once you have a family where they have alcohol use disorder, you will see that that family will have a lot of people that drink alcohol. So that lays credence to the genetic component of the disease. Now, it's also been shown that alcohol use disorder is more common in monozygotic twins, and this is twins born with the same placenta. So they're twins, and they share the same umbilical cord, the same placenta. So their different cords go to the same placenta, and this is it's been shown that twins that have the same placenta in their mother's womb, if one is drinking, the chances of the other one being alcoholic as well is very, very high. That shows that there is some genetic component. Then it's also been shown that even dizygotic twins, that is twins that have different placentas, may have some amount of alcohol use together, but it's much less compared to monozygotic twins. So that is genetic component of alcohol use disorder, which means it's genetically inherited from parents from parents to the children. The other causes may be psychological. So sometimes people self-treat their psychological problems with drugs. So people who feel depressed or who have a low self-esteem, they drink a little alcohol and they feel more energetic, they feel more confident in themselves, they can talk to the girls. When they drink a little alcohol, from then they begin to drink more and more. Or sometimes they feel depressed and they know that if they drink some alcohol, they feel a little happier, they begin to drink more and more and they get addicted to it. Sometimes it could be a social class issue. It's known that people in certain social class, because they hang out together, they drink a lot together, and the group effect is there, so they continue to drink. Also, environmental is known that in some low social economic class areas where there's so much liquor store, there's not much they're doing, they hang out around the liquor store and all they do is drink and drug. So it depends on what could be the initiating factor. It could be genetic, and it could also be psychological, social, or environmental. So sometimes people find themselves in certain places and all they do is drink, which is so sad. Now let's take a look at the complications of alcohol use disorder. Now we know that alcohol depresses the central nervous system. Initially, when you drink a little alcohol, it causes some stimulation. People feel happier, they talk more, they're more confident, because alcohol suppresses the frontal lobe. So the frontal part of the brain, this is the area that helps us make some correct judgments, or that makes you inhibited when you see some things because your frontal lobe is still working or functional, you don't say some things or you don't talk to some people. But once you drink alcohol, it suppresses that inhibition, then people feel more freer. That's why when people go to parties, if alcohol is not served yet, everyone is sitting quietly, nobody's dancing, maybe a few people who are really disinhibited without alcohol. But once alcohol is served, you see everybody jumping up and dancing because the frontal lobe at that point is suppressed. So people feel happier, freer, because their frontal lobe is now suppressed. They can dance and jump all over the place. So initially, alcohol is stimulating. Then later, when you drink more, it impairs the central nervous system. It suppresses the central nervous system. At that point, it affects different parts of the brain. The speech center, people become slurred. They have slurry speech. They have poor muscle coordination because it weakens the muscles. People can't stand erect anymore. Some people are tripping over and falling. And if they continue to drink in quick succession and a lot, they go into coma, and people die if the amount of alcohol they've taken is quite heavy. So initially you have some stimulation, some excitement, then depression of the brain and central nervous system, muscle weakness, and they may go to coma and die. Also, other complications are poor safety, because alcohol causes poor judgment and lower inhibition, and people take more risky behavior. And that's when they get into motor vehicle accidents or people drown. Because they're drunk, they can't make correct judgment, and they jump into even dangerous waters, thinking that it's shallow because of their poor judgment, and they drown. People have drowned in Florida and in some dangerous waters because they could not make the right judgment at that time. Some people even jump into deeper areas of the swimming pool, where if actually they were not drunk, they would not go into such areas because they know that they cannot swim in such deep areas. Other complications of alcohol use is relationship problems. People get into fights with their spouses, with their children. They have, at their work, they have problems with their co-workers and all that. So that's another thing. Also, they have poor work performance, and they get into violent crimes, or they become victims of violent crimes, because when you're drunk, you go to wrong places, you be at the wrong place at the wrong time, you give a ride to people you shouldn't give a ride to, and people's cars have been taken away, or people have been pushed out of their cars or killed because they were drunk and they made the wrong judgment of picking up strangers or picking up wrong girls. They get into legal problems. They get arrested, driving under the influence. Other complications of alcohol use disorder is financial problems. People spend all their money drinking, spend their rent money or mortgage money drinking, and so they get their cars repossessed, or they are evicted from their homes. When people are drunk, they take risky sexual behaviors where they should use protection in sex. They don't care because they are drunk. At that point, they make poor judgments, and they end up getting sexually transmitted disease. They may be lucky if it is simple STDs like gonococcal infection, but if it is untreatable sexual transmitted diseases like herpes or HIV, of course they are in bigger trouble because there is no real treatment for that. Also, when people are drunk, they become victims, sexual victims. They get raped, and sometimes people get raped and they are killed. So those are some of the dangers of using alcohol excessively or having alcohol use disorder. Now, it's also been shown that people who committed suicide, whether attempt or completed suicide, a lot of the times they are high on drugs and alcohol, because people know that they cannot actually have completed suicide when they are thinking right. So sometimes they drink so much alcohol to block their normal way of thinking, because they know that when they are drunk, their judgment is impaired, and at that point they can really carry out their suicide plans and suicide attempts. So a lot of people die from suicide after they've been drunk because their judgment is poor, they are more agitated, and they can carry out the plans they've had in their minds for a long time. Now, let's take a look at the effects of drinking alcohol on our health. Alcohol is toxic to our liver. It damages the liver. So continuous drinking of alcohol brings continuous insult to your liver. And if you continue to drink constantly, you have what is called fatty liver. So the liver cells will be taken over by fats, and the amount of liver cells you need to help you with the detoxification in the body, to help us protect our body, do the work of the liver, will be reduced and replaced by fat, and that is called fatty liver. If you continue to drink, people have damage to the liver cells, and they could have what is called alcoholic hepatitis, because alcohol is toxic to the liver. The liver cells will become inflamed, and that is called alcoholic hepatitis. Also, at the long run, the liver cells become thickened, shrunken, and the person develops liver cirrhosis. At that point, there is nothing that can be done other than liver transplant. So, alcohol is directly toxic to the liver, and people could end up having liver cancer. So people have to be very, very careful. Other effects of alcohol on our health is people can have gastritis, because alcohol could cause irritation of the stomach wall, and people develop gastritis, stomach pain, and also they could develop gastric ulcer, duodenal ulcer, and when they vomit, they throw up blood, and that could be very dangerous. People over time, they develop enlarged veins in the esophagus, which could rupture and bleed, and when you lose a lot of blood, people could die. So those are some of the bad effects of alcohol on our bodies. Also, because when people drink alcohol, they cannot absorb vitamin B properly, so they have vitamin B deficiency, and vitamin B is very important in our nerve cells. That could lead to problems with the brain, with memory, dementia, and all that. People could also develop pancreatitis. So you have alcoholic pancreatitis, and when the pancreas is constantly inflamed, you end up not being able to produce insulin, and people have diabetes from that. Alcohol also could cause high blood pressure, heart disease, and could lead to congestive heart failure, which will eventually lead to death. So alcohol overall is very, very dangerous if people are drinking too much. Now, alcohol also could have sexual side effects. When people drink a lot of alcohol, they have erectile dysfunction. People who drink alcohol may have problem achieving erection, leading to sexual problems. Females will have menstrual problems. They have inconsistency with their menstrual period. Also, when people drink a lot of alcohol, they have vitamin B1 deficiency, which is thiamine, and people could have paralysis, muscle paralysis, especially of the eyes, and they can't move their eyes. Sometimes they have what is called nystagmus. They have flicking of their eye muscles, eyeballs. Some other symptoms could be dementia, memory problems because of toxic effect of alcohol on our brain. It is also unfortunate to see some females drink alcohol in pregnancy. Alcohol could cause birth defects, the so-called alcohol baby syndrome. You see a child born with deformed face, they have tiny mouth, very tiny jaw, the jaw bones are malfunctioned, malformed, and they have all kinds of behavioral problems. So when a female is pregnant, it's always advisable, please do not drink alcohol. Exposing that child to alcohol could cause brain damage, and they come out with all kinds of problems. And alcohol could also cause miscarriage. You could lose the pregnancy. Alcohol also reduces our immune system. When our immune system is reduced, we're prone to infections and all forms of diseases. It has also been shown that alcohol, people who drink a lot of alcohol are prone to cancer, especially cancer of the mouth, the throat, liver, colon, and breast cancers. So these have all been been associated with alcohol use disorder. So different types of cancers have been associated: mouth, tongue, throat, liver, colon, and breast cancers. Now, it's also known that alcohol interacts with some of the medications we take. Alcohol plus benzodiazepines and things like Xanax, Klonopin, other benzodiazepines equal to death. When people are drinking a lot of alcohol, if you add benzodiazepine to it, it suppresses the respiratory system, and people go to bed and they don't wake up. I had a patient who had been on Xanax, did very well, but the brother gets home from a rehab, and that night they were drinking. She hadn't had alcohol in a while. She took her Xanax, drank alcohol. She couldn't stand up from the floor to go to her room. So the brother said, well, don't worry about it, just sleep on the floor. The next morning she was cold dead. So alcohol plus benzodiazepines, especially Xanax and clonazepam, will suppress the respiratory center, and the person cannot breathe anymore, and they will die in their sleep. So it's dangerous to combine alcohol with benzodiazepines. Also, combining alcohol with pain medication, OxyContin, Percocets, as well as other opiates, of course drugs like heroin, will kill the person. So it's always advisable not to combine alcohol with benzodiazepines and pain medications. That could be very, very fatal. Someone could die. So please do not combine those. All right, I see Chuck, thank you for tuning in. Also Shama, thank you for tuning in today, and as well as Dwight, thank you for tuning in and also sharing this video. So let's look at treatment. How do we treat someone with alcohol use disorder? Alcohol use disorder. First of all, someone who has been drinking a lot cannot stop drinking alcohol cold turkey. No, you cannot stop. You're better off drinking, reducing the amount very gradually, and that means tapering off, but you will need to go through detoxification. Because if you stop cold turkey, you go through severe withdrawal, could have delirium tremens, could have seizure disorder, which could be fatal. People die from stopping drinking alcohol cold turkey. So you have to go through detoxification, and this is a medical management to avoid deadly withdrawals. So most times, alcohol withdrawal symptoms starts from a few hours, could last up to 3 to 7 days. So we admit the patients into a unit, into hospital, and put them on benzodiazepines to avoid the withdrawals. We use mostly chlordiazepam oxide, which is Librium, or clonazepam, and this will prevent the withdrawal symptoms and slowly taper off the benzodiazepines, and they don't go through those withdrawals. Now, there are other medications that you use to prevent further drinking. Commonest among them is a medication that is called naltrexone. Naltrexone we give is an oral medication. You take it by mouth once a day. What it does, it blocks the pleasurable feeling of alcohol. So alcohol makes people feel happy and all that. So naltrexone reduces that feeling. Also reduces cravings. It prevents the desire, the craving, the feeling of wanting to drink. So naltrexone helps to prevent that. There is also an injectable form of naltrexone called Vivitrol. Vivitrol is available. It's given as an injection once a month. And this makes it easier to take, because a lot of people, it's hard actually to take pills every day. So people who are addicted to alcohol, they get Vivitrol injection once a month. Once you take that injection, you don't need to do anything else until next time. Next month you get another injection. So this naltrexone, which is in the injectable form, Vivitrol, helps prevent the cravings, so you don't have the desire to go drinking. The other medication that is used to stop the craving is acamprosate. Acamprosate is a medication that we give, so it helps people to prevent the craving as well. There is the Antabuse. Antabuse is a medication called disulfiram. What it does, it exaggerates the negative effects of alcohol use. So when people drink excessively, what happens is they have vomiting, they have nausea, they feel flushed, they have flushing, and they also have headaches, and they don't want to drink alcohol. So if you drink alcohol and take disulfiram with it, these symptoms come in very powerful ways. So the vomiting, the retching, the headache is so much that you run away from alcohol. So it's a kind of punishment. It's a negative reinforcement. If you drink alcohol, you have those problems, so you run away from alcohol. So the other ways of treating alcohol use disorder, you go through psychological therapy, counseling, both individual and group therapy, addiction counseling. Some also, because people who do alcohol, they have conflicts with their family, and sometimes family conflict will predispose people to drinking, so to run away from their problems. So they go drinking. So couples therapy and family therapy is also very helpful. It's also good to treat the co-occurring problems. People start drinking because they're depressed, so they drink alcohol to feel good, or people who have anxiety drink alcohol because alcohol calms them down, so they drink. So if you treat the co-occurring problems, they don't have any need to drink anymore. There are support groups out there like Alcoholics Anonymous. People go share their problems, and you get a sponsor. This will help to stay out of alcohol use disorder. It's also been shown that spirituality is very helpful. So those that have spiritual groups, religious groups, it doesn't matter which one, it's been found that maintaining your spiritual group, spiritual insight into your problem, helps people to quit and stay away from alcohol. So alcohol use disorder, in conclusion, is a very difficult problem. It is used worldwide, and it costs people their lives from motor vehicle accidents, killing people, and also people getting killed from drinking and driving or drowning. So it's a major problem, but the good thing is treatable. So if you have any of these symptoms I've talked about, getting into conflicts with the law, with your family, you need to go get some help. There are healthcare providers out there who will help you. Also, family members, you can refer your loved ones so they can get help and get better. So it's a problem that is treatable. Go get help. I want to encourage you that there is help out there to get free from alcohol. Thank you very much for tuning in today on Dr. Gilead Show. We talked about alcohol use disorder. I am your host, Dr. Theo Swala. I'm a psychiatrist. My office is on 9470 Annapolis Road, Suite 117, and you can call the office on phone number 301-577-9111, 301-577-9111, and you get the help that you need. There are therapists, there are doctors that work with me, and who can get you the help you need. Thank you for tuning in. Stay connected with me on Facebook Live, Dr. Theo, one word, Oswala MD, one word, Dr. Theo Oswala MD, one word. Check us out on Facebook, and you can also go on YouTube, Dr. Gilead Show, and watch the previous episodes that we talked about, and you can listen and make your comments. Thank you for tuning in. Stay tuned. Come back next week, Thursday at 1 p.m. Eastern Standard Time, and I will have another topic for you. Thank you very much. Enjoy your day.